Now, the last thing I'd like to talk about in terms of relief for headaches is something that I'm guessing about probably 25% of you are familiar with and 75% of you are not, which is curcumin. Curcumin is often also referred to as turmeric, and turmeric is a root, and curcumin is one of the key components of that root. Curcumin is known to have very potent anti-inflammatory properties. I don't think that's debated at all. In fact, it's so potent as an anti-inflammatory that some people have cautioned against taking high levels of curcumin prior to, for instance, resistance training workouts or even cardiovascular workouts, because it so prevents inflammation that it also can prevent the adaptation response. Because remember, the inflammation that occurs during exercise, both resistance and cardiovascular exercise, is at least in part the trigger for the adaptation that it's going to lead to enhanced endurance, enhanced strength, hypertrophy, etc. Nonetheless, curcumin has been explored in the context of treatment of migraine, and it's one of the compounds that was analyzed in extensive detail in this wonderful review that I mentioned a little bit earlier. What I like about this study is that they were able to explore the effects of curcumin as explored in previous research studies and compare those across a large range of different dosages and a large range of combinations with other things like coenzyme Q10, which we've talked about on this podcast before. But I think for sake of this discussion, just really focusing on what curcumin does alone or in conjunction with the omega-3 fatty acids is what turns out to be the most interesting. First of all, curcumin has been shown to be generally safe for most people at dosages as high as 8,000 milligrams per day or 8 grams per day. Now, I want to be very clear. I do not recommend that anyone take dosages of curcumin, aka turmeric, that are that high. Why? Well, curcumin and turmeric not only are anti-inflammatory, but they also can impinge on other pathways, in particular hormonal pathways. And in fact, curcumin, aka turmeric, can alter the synthesis of something called dihydrotestosterone. Dihydrotestosterone is involved in an enormous range of different bodily functions. It's involved in libido, it's involved in men in beard growth, and in the regulation of a number of different tissues, both in the reproductive axis and outside the reproductive axis. And curcumin is a potent inhibitor of DHT. So I do want to caution that people who take high doses of curcumin, and some people who are very sensitive to curcumin, will, even at low doses, experience reductions in DHT that lead to things that they would not like, such as sufficient reductions in libido. However, curcumin has been shown to be effective as an anti-inflammatory and has been shown to be very effective in treating different types of headache, in particular migraine headache. One of the ways in which curcumin does that is to inhibit this thing that I talked about a few minutes ago, which is nitric oxide, or NO, which causes vasodilation. And in doing that, can reduce the feeling that one has a lot of intracranial pressure. Okay, so curcumin dosages come in an enormous range, as I mentioned before, dosages that range anywhere from 80 milligrams per day, that is, taken for 8 weeks' time. That's been examined. It's been explored at 80 milligram dosages taken alongside 2.5 grams of omega-3 fatty acids or omega-3 fatty acids alone, and against placebo. And the general conclusion of these studies is that curcumin, when taken at dosages of about 80 milligrams, although for those of you very sensitive to curcumin, probably as low as 25 or even 50 milligrams per day, in conjunction with, although not necessarily at the same time, but taken daily alongside omega-3 fatty acids at 2.5 grams per day, led to significant improvements in migraine and other forms of headache, meaning both the frequency and the intensity of the headaches that occurred was greatly reduced. One important point about curcumin to keep in mind is that curcumin is known to inhibit something called cytochrome P450. That's associated with an enzymatic pathway and some other things that relate to blood coagulation. So for people that are taking medications that are anticoagulants to prevent clotting, you do need to be very cautious about using curcumin. And of course, with curcumin or any other supplement, you should always talk to your doctor prior to including it or removing it from your supplement regimen.